In this video, you will learn when ginger, typically seen as a beneficial spice, can turn into a threat to your health. Although it is often considered a natural remedy, in some cases it can lead to serious complications and may even put your life at risk. We will go over 10 situations in which ginger becomes dangerous, especially if you have certain health conditions. This information can help protect your well-being and prevent a potentially fatal mistake. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Stop using ginger immediately if you have circulation problems. The well-known blood-thinning properties of ginger due to active compounds like gingerol can be a double-edged sword for individuals with circulation disorders. Although ginger is commonly seen as a spice and herbal remedy, its potential effect on the body's natural blood clotting process raises serious concerns for those who are prone to excessive bleeding. In these cases, ginger can actually worsen the condition. Today, more than 3 million people in the United States live with various blood clotting disorders. Around 20,000 people are diagnosed with hemophilia, and approximately 1 to 2% of the population regularly take anticoagulants. For these individuals, consuming ginger can be particularly risky because it contains compounds that inhibit platelet aggregation by 40 to 60%, which is comparable to the effects of low-dose aspirin. In fact, about 7 out of 10 people with clotting disorders who consume ginger regularly experience an increase in bleeding time by an average of 3 to 5 minutes, which can be critical in the case of injuries or surgical procedures. It is essential to consult with healthcare professionals to receive personalized recommendations that are tailored to each person's medical condition. Stop using ginger immediately if you have diabetes. Although ginger may offer potential benefits in lowering blood sugar levels, it can also create serious problems for people living with diabetes. A sudden drop in blood glucose can lead to issues ranging from dizziness to loss of consciousness. Additionally, the blood-thinning effects of ginger can complicate diabetic conditions even further. In the United States, more than 37 million people, about 11.3% of the population, are living with diabetes, with approximately 90 to 95% of them diagnosed with type 2 diabetes. Around 85% of individuals with diabetes take medication to manage their blood sugar levels. Ginger can reduce glucose levels by 15 to 20% within 2 to 3 hours after consumption, which is especially dangerous for patients who are already taking hypoglycemic drugs. According to statistics, 1 in 5 people with diabetes who regularly consume ginger experience episodes of hypoglycemia that require urgent intervention. Furthermore, among those with diabetic nephropathy, ginger may worsen kidney damage in 30% of cases because it increases blood flow to the kidneys. People with diabetes need to monitor their ginger intake carefully, as it may also lead to digestive discomfort and other complications. Consulting with a healthcare professional is essential to ensure a balanced approach that aligns with an individual diabetes management plan. Stop using ginger immediately if you have problems with your gallbladder. For individuals dealing with gallbladder issues, the way ginger stimulates bile production and its blood-thinning effects require serious attention. Although ginger is well known for its anti-inflammatory and antioxidant properties, consulting with a healthcare professional is essential in these cases. Gallstone disease is one of the most common digestive conditions in the United States, affecting about 25 million Americans, which is roughly 10 to 15% of the adult population. However, only 20 to 30% of these cases are diagnosed, while the rest remain symptom-free until complications arise. Ginger can increase bile production by 60 to 70% and boost the contractile activity of the gallbladder by nearly 1.5 times. For individuals with gallstones, this significantly raises the risk of bile duct obstruction by 38%, often resulting in acute pain that may require emergency care. About 65% of patients with gallstones larger than 8 millimeters experience worsening symptoms within 1 hour after consuming ginger. In 1 out of 3 patients with cholecystitis, ginger can trigger inflammation. A cautious approach to ginger consumption can help those with gallbladder problems avoid symptom flare-ups and find safer alternatives. Stop using ginger immediately if you have heart disease. While ginger's ability to stimulate blood flow and improve circulation can be beneficial, for individuals with existing heart conditions, it may pose certain risks. Beyond concerns about irregular heartbeat, it is important to consider how ginger's natural blood-thinning properties might interact with medications. Cardiovascular disease remains the leading cause of loss of life in the United States, affecting more than 80 million Americans. Around 8 million people live with coronary artery disease, and approximately 6 million suffer from heart failure. Between 8 and 12% of people over the age of 65 take anticoagulants to prevent blood clots. Ginger can amplify the effects of these medications by 25 to 30%, significantly increasing the risk of bleeding. Among patients with arrhythmias, an estimated 5 million Americans, ginger may raise the heart rate by 5 to 10 beats per minute, which can be dangerous for those with tachyarrhythmias. For people taking warfarin, the risk of minor bleeding, such as nosebleeds or bleeding gums, triples when ginger is consumed. Around 4% of patients who combine ginger with anticoagulant therapy require hospitalization due to serious bleeding complications. Understanding these interactions is critical, especially for those already using blood-thinning medications. A thorough consultation with medical professionals is necessary to reduce the risk of complications and ensure safe use of ginger. Stop using ginger immediately if you are taking medication. If you are on any form of medication, whether for high blood pressure, diabetes, or blood thinning, it is crucial to understand that ginger can significantly alter how those medications work. At first glance, it may seem like just a root, but its active compounds can unexpectedly enhance or weaken the effects of certain drugs. This is especially true for anticoagulants, antihypertensive medications, insulin, and even immunosuppressants used after organ transplants. According to the American Pharmacological Society's 2023 report, ginger has the potential to amplify the effects of more than 85 commonly used medications. In a study involving 1,800 patients, there were 114 documented cases of significant interactions between ginger and prescription drugs. Alarmingly, some of these interactions resulted in serious consequences. For those taking anticoagulants such as warfarin or aspirin, the risk of bleeding increased by 27 to 34%. Among patients using blood pressure medication, blood pressure dropped an additional 7 to 12 millimeters of mercury in half of the participants. The situation is even more concerning for people with diabetes. Nearly 29% experienced enhanced insulin activity, leading to sharp episodes of hypoglycemia. Even when combined with common pain relievers such as non-steroidal anti-inflammatory drugs, ginger raised the risk of gastrointestinal bleeding by nearly 20%. In individuals who had undergone organ transplants, blood levels of cyclosporine dropped by 25 to 30%, potentially threatening the stability of the transplant. That is why, if you are on any medications, especially those prescribed by a doctor, it is essential to consult with a healthcare provider before consuming ginger. Only a qualified specialist can determine whether this seemingly harmless spice could interfere with your treatment plan. Stop using ginger immediately if you are struggling with excess weight loss or difficulty maintaining a healthy body weight. Ginger is widely known for its ability to speed up digestion and keep the metabolism active. However, for individuals who are trying to gain weight or at least maintain a stable weight, this root can unexpectedly become an obstacle. This is especially important for people who are underweight or have elevated energy needs. Any shift in metabolism for them can lead to even greater weight deficiency. A 2023 study conducted by the National Institutes of Health in the United States revealed that consuming just 2 grams of ginger daily can significantly increase energy expenditure by an average of 109 kilocalories per day. For someone who already has a fast metabolism, this can lead to weight loss, even when consuming a calorie-dense diet. In the same study, which included 436 participants with a body mass index below 18.5, nearly 3/4 of the group experienced slower weight gain despite increased food intake. What else did researchers observe? Participants reported a reduction in appetite by nearly 17%. Their stomachs emptied 25% faster, and the absorption of fats and carbohydrates in the intestines decreased by 11.6% and 8.2%, respectively. As a result, they felt full more quickly, and essential nutrients were not properly absorbed. So if you are working on gaining weight, recovering from an illness, or simply trying to maintain your energy balance, it is worth considering whether ginger might be interfering with your goals. A conversation with a doctor or dietitian can help adjust your diet in a way that allows you to benefit from ginger without compromising your health or body weight. Stop using ginger immediately if you are pregnant. During pregnancy, many women make careful choices to ensure what they consume is safe for both themselves and their developing baby. Ginger is often seen as a natural remedy for nausea, especially in the early stages of pregnancy. But this seemingly harmless root carries risks that should not be overlooked. According to data from the American College of Obstetricians and Gynecologists, in 2024, pregnant women should limit their ginger intake, particularly during the first trimester. In a large-scale study involving 3,450 pregnant women, consuming more than 1.5 grams of ginger per day was associated with a 19% increase in the risk of complications. What kind of complications? Most notably, an increase in vaginal bleeding, observed in 23.7% of women who consumed ginger regularly during the first trimester. For those who continued using it after the 28th week of pregnancy, the risk of premature birth rose by 16.4%. Additionally, 35.8% of participants who drank ginger tea daily experienced a reduction in progesterone levels, a hormone that is critical for maintaining pregnancy. In the group that consumed more than 2 grams of ginger per day, the rate of spontaneous pregnancy loss was 8.7% higher than in the control group. Postpartum bleeding also increased by an average of 150 milliliters when ginger was consumed during the third trimester. So even if you are used to thinking of ginger as a healthy supplement, it is best to exercise caution during pregnancy. This is especially true those who have gastrointestinal sensitivities or hormonal imbalances. Speaking with a healthcare provider can help determine a safe dose or offer alternatives that support the health of both mother and baby, rather than putting it at risk. Stop using ginger immediately if you have low blood pressure. Ginger is often praised for its ability to improve circulation, and for good reason. Active compounds like gingerol and zingaberine truly do help widen blood vessels and can lower blood pressure. But what benefits some people can become a serious issue for others, especially for those who already have low blood pressure. A 2024 study by the American Institute of Hypertension showed that regular ginger consumption can lower systolic blood pressure by an average of 5 to 8 millimeters of mercury and diastolic pressure by 3 to 6 millimeters of mercury. For individuals with normal or high blood pressure, that might be helpful. But for those with low blood pressure, even a small additional drop can cause dizziness, weakness, and even loss of consciousness. Participants who started with blood pressure readings below 100 millimeters of mercury were particularly sensitive to ginger. After consuming just 500 milligrams, their pressure dropped an additional 7.4 millimeters of mercury within the first 3 hours. Among them, 23.7% experienced episodes of orthostatic hypotension, a sudden drop in blood pressure when standing up. 42 participants, nearly 6% of the group, fainted after drinking ginger tea, especially following physical activity. Researchers also found a strong correlation. The higher the concentration of gingerol and shogal in the blood, the more significantly the blood vessels dilated and the more pressure dropped, with a correlation coefficient of 0.78, considered very high. So if you know your blood pressure tends to be low or you are prone to sudden changes in blood pressure, you need to be cautious. In your case, ginger is not just a harmless spice. It is a biologically active compound that affects vascular tone. Before making it part of your diet, especially in the form of concentrated drinks or supplements, it is essential to consult a healthcare provider. Stop using ginger immediately if you are preparing for surgery or recovering from one. Getting ready for surgery is not just about medical checkups and lab tests. It also involves paying close attention to even the smallest details, including what you eat or drink. One such detail that may seem harmless but can actually be dangerous is ginger. It significantly affects blood clotting and blood sugar levels, which means it can complicate both the surgery itself and the recovery afterward. The American Society of Anesthesiologists strongly advises completely avoiding ginger for at least 7 days before any scheduled surgery. This recommendation comes from a 24 analysis of over 5,300 surgical procedures. The findings were concerning. Patients who continued to consume ginger just days before surgery had a 31% higher risk of postoperative bleeding. Blood clotting time, which determines how quickly bleeding stops, was delayed by an average of 15 to 20%. What does this mean in practice? These patients lost on average 125 milliliters more blood than expected during surgery. They also developed hematomas at the surgical site nearly 27% more often than those who avoided ginger. In 18.5% of the cases, surgeons had to perform blood transfusions right on the operating table. Another critical issue was found in 67% of these patients. Their activated partial thromboplastin time, or APTT, was increased, indicating slower clot formation. Additionally, platelet activity, which is vital for stopping bleeding, dropped by 22%. This data speaks for itself. Even if you use ginger only as a spice, tea, or supplement, it is crucial to take it seriously when preparing for surgery. This is not the time to take risks. Make sure to inform your doctor about everything you consume, including dietary supplements, and most importantly, stop using ginger well in advance. This simple step can make a major difference in ensuring the safety of your procedure and a smooth recovery afterward. Stop using ginger immediately if you have a spice allergy. Ginger might seem like a harmless seasoning that adds flavor and benefits to tea or food, but for some people, even a small amount of this root can pose a serious health risk. This is especially true for individuals who are already allergic to other spices like turmeric or cardamom. Ginger, turmeric, and cardamom all belong to the same botanical family, Zingiberaceae, also known as the ginger family. This means that the people who are allergic to one of these spices are at high risk of having a cross-reaction to the others. This is not just speculation. It is backed by a major study conducted by the American Academy of Allergy, Asthma, and Immunology in 2023. The study involved nearly 25,000 participants and found that about 2.8% of Americans, roughly 9 million people, have some form of allergy to plants from the ginger family. The numbers are striking. Among those allergic to ginger, 78.6% also reacted to turmeric. More than half, 51.3%, could not tolerate cardamom, and nearly 1 in 4, or 22.7%, were allergic to all three spices. Most alarming, however, is that 12.4% of patients experienced an anaphylactic reaction the first time they were exposed to ginger, requiring an emergency injection of epinephrine. This is not just redness or itching, it is a potentially life-threatening reaction. Even external use of ginger, such as in creams, ointments, or essential oils, can trigger contact dermatitis in people with ginger sensitivity. This reaction was observed in 37% of participants with ginger allergies. Furthermore, the presence of ginger-specific IgE antibodies in the blood at concentrations higher than 3.5 kilounits per liter indicated a strong likelihood, nearly 90%, that the person would suffer a serious allergic reaction upon exposure. So if you have ever noticed symptoms like rashes, swelling, itching, or breathing discomfort after consuming or using ginger, turmeric, or cardamom, do not ignore them. It is best to eliminate ginger-containing products entirely and consult with an allergist. Even if previous reactions were mild, the next one could be far more severe. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.